welcome to the Deep Dive. Today, we're taking a look ahead at something pretty significant happening next year.
Right.
The Psychedelic Science Conference. It's in Denver, June 16th to 20th, 2025.
Yeah, and the theme this time around is the integration, which, really says something.
It does, doesn't it? Like how these substances, this science, might actually weave into mental health, medicine, maybe even how we think about consciousness itself.
Exactly. It feels like a potential turning point, moving maybe from pure research into broader, application.
In the scale they're talking about.
Mm-hmm.
Over 12,000 attendees expected.
12,000, that's huge. It really signals the kind of momentum building up here.
Absolutely. So our mission today, for everyone listening, is to kind of unpack this event. What's the core of it? What makes it stand out?
And what could the ripple effects be, right? For mental health care, for policy?
Exactly. So let's dive in. What's the general vibe they're going for? What's the overall experience supposed to be like?
Well, they're pitching it as an extraordinary week. So, high expectations. But it sounds like more than just talks. They've got this concept called deep space, described as a dazzling, immersive, creative zone.
Interesting. So not your standard conference hall fluorescent lighting setup.
Apparently not. Think art installations, activities, something designed to be, engaging on a different level, maybe more experiential.
Okay, that sounds intriguing. And then there's the expo hall. They mentioned that too.
Right, and they're calling it massive, hundreds of organizations involved.
Wow. So businesses, nonprofits, research groups.
Presumably all of the above, psychedelic organizations, various projects, businesses in the space. It sounds like a real hub.
A chance to get a sense of the whole ecosystem then.
Exactly. Seeing that range of players, from
Yeah.
research to potential service providers all in one place, it definitely suggests the field is, maturing maybe, moving beyond just the lab.
That makes sense. Okay, what about the learning side, the actual sessions?
Yeah, that's obviously core. They're planning more than 10 educational stages running at the same time.
10 stages.
Yeah, with presenters coming in from all over the world, apparently. Hundreds of sessions planned.
So a massive amount of information being shared.
It seems so. And they're emphasizing the breadth, not just the science.
Right. You mentioned integration.
Yeah.
So covering different angles.
Exactly. Expertise from medicine, healthcare, sure, but also commerce, business side of things, policy, culture.
All the pieces needed if this is going to integrate responsibly.
That seems to be the idea, bringing all those perspectives together.
Okay. And they've broken it down into specific tracks, right?
Yeah.
Help navigate all that content.
Yeah, 14 programming tracks, which gives you an idea of the scope.
14. Let's touch on some key ones. What about the keynote track? Big names, big ideas.
Presumably. That's usually where you get the high-level view, the sort of vision-setting talks, exploring how psychedelics might fit into the bigger picture of society and culture.
So setting the tone for that integration theme.
I'd expect so. Discussions around public perception, major challenges, opportunities, that kind of thing. Probably generate a lot of buzz.
Okay. Then there's one called Black Liberation, a half-day series.
Yes, specifically focused on plant medicine's potential role in supporting Black communities.
In what way?
Addressing healing from systemic racism, trauma, exploitation. It looks like a really focused and, frankly, vital conversation.
Yeah, that sounds incredibly important. Addressing equity and specific community needs head on.
It really does. And focusing specifically on plant medicines in that context is noteworthy, too.
Definitely. What else stands out? There's a business track?
Right. This seems very practical. Focused on the infrastructure needed for, safe and responsible access.
So the nuts and bolts.
Pretty much. Covering finance, drug development, the regulatory hurdles, clinics, tech, community institutions, everything needed to build a working system.
That's crucial if this moves beyond research into actual therapy.
Absolutely. You need that framework, ethical, sustainable. This track sounds like it brings together the people building it.
And alongside business, there's a community track.
Yeah, which feels like a good balance. This one's about dialogues, stories, bringing in diverse voices from within the psychedelic space.
So highlighting lived experiences, different perspectives.
Exactly. Making sure it's inclusive, reflecting the people involved or who could benefit, or those with, long-standing traditions with these substances.
Right. Okay, let's shift to the science itself. There's a dedicated science track.
Of course. That's foundational. Covering the latest in neuroscience, pharmacology, chemistry, basically how these things actually work in the brain.
Understanding the mechanism.
Precisely.
Yeah.
Which is key for developing effective therapies.
And is that different from the studies track?
Similar, but studies seems broader. Presenting new research findings across the board, clinical trials, yes, but also naturalistic use, risk assessment, public opinion, health and wellness studies, even looking at religion, spirituality, global culture.
Wow, okay. So a wide net for research findings.
Seems like it. And then there's also trials, which is very specific.
Focus just on clinical trials.
Yeah, findings and updates from trials looking at psychedelics for serious mental illness, neurological disorders, the conditions where there's a lot of hope.
That feels incredibly relevant given the potential for things like depression, PTSD.
Absolutely. These trials are the bedrock for potential medical approval and wider acceptance. The data shared there could be huge.
Makes sense. What about the legal side? Regulations.
That's the policy track. Looking at the legal frameworks needed for safe access, especially as things shift away from prohibition in some places.
So navigating that complex legal landscape.
Right. How do you build regulations that work, that ensure safety, ethics? It's a massive piece of the puzzle.
And very timely, especially with what's happening in some U.S. states. Is there anything specific on that?
Yes, actually. A single-day forum track called Statewide.
Oh, focused on?
Colorado and Oregon, looking at their new state-regulated access systems.
That's super relevant, learning from those early examples.
Exactly. What's working? What are the challenges? Real-world lessons for other places potentially considering similar moves.
Got it. Any other tracks focused on specific groups?
There's a veterans track, also a single-day forum.
For veterans and first responders.
And their families, yes, focusing on psychedelic healing movements, specifically within those communities.
That's significant. Addressing the high rates of trauma often found there.
Definitely highlights a specific need and the efforts underway to meet it using these potential therapies.
Now this is interesting. Rick Doblin has his own track. It's called Doblin.
Yeah, the founder of MAPS. It sounds like his personal selections, highlighting the history, the pioneers, research, therapy, culture.
Like a curated history lesson from someone who was there for much of it?
Pretty much. His perspective on the context, the key figures.
Yeah.
That would be invaluable for understanding how we got here.
No doubt. What about the plant medicine track? How does that differ from, say, the science tracks?
This one seems focused on ethnobotanical practices, so indigenous uses, traditional spiritual contexts, as well as contemporary uses of psychedelic plants.
Ah, so acknowledging the deep history and cultural roots. What does ethnobotanical mean exactly in this context?
Right. Ethnobotany is basically the study of how different cultures use plants. So here it's about honoring and learning from those long traditions, especially indigenous knowledge, where these plants have been used for, well, centuries, respecting that context.
That's crucial. Okay, just a couple more tracks. Society.
Yeah, looking at how psychedelics intersect with, well, everything else. Pop culture, art, music, media, religion, spirituality, ethnicity, the community itself.
The broader cultural ripples.
Exactly. And finally, there's therapy.
Aimed at clinicians.
And facilitators, yeah. In-depth discussions on intake, integration, best practices, training, ethics, the practicalities of delivering care.
Essential for the practitioners on the ground.
Absolutely. Ensuring they're well-trained, ethical, using evidence-based methods as things develop.
Wow. Okay, that is comprehensive. They really seem to be covered all the bases.
It certainly looks that way. The sheer number and focus of the tracks is impressive.
And they've started announcing speakers, too. Any highlights there? The list looks pretty diverse.
It really does. It mirrors the tracks, pulling in people from research, clinical practice, advocacy, cultural commentary.
Give us a few examples. Who stands out?
Well, you've got Sutton King from the Urban Indigenous Collective, very important perspective there.
Right.
Leor Roseman, a key researcher from the University of Exeter. Hanifa Naya Washington, who's involved with the Psychedelic Health Equity Initiative and also the Fireside Project.
Fireside Project, that's the support line, right? Crucial work.
Absolutely vital, yeah. So you see that mix already. Indigenous perspectives, core science, health equity, harm reduction.
Okay, who else?
Alan Davis from Ohio State's Psychedelic Research Center. Pilar Guzman, editorial director at Oprah Daily.
Oprah Daily.
Yeah.
That's interesting. Shows the mainstream crossover.
Definitely signals that broader awareness, yeah. And then Bessel van der Kolk.
Wow. The Body Keeps the Score author. Huge name in trauma.
Exactly. His presence really underlines that potential connection between psychedelics and treating complex trauma, builds right on his influential work.
Makes sense. And some foundational figures, too, I imagine.
No, yes. Paul Stamets, the mycologist, obviously deeply knowledgeable about fungi.
Right, Mr. Mycelium.
Rick Doblin, of course, MAPS founder, absolutely central to the whole renaissance of research.
Decades of work there.
Truly. And Robin Carhart-Harris, now at UCSF, whose brain imaging studies have been so groundbreaking.
Yeah, showing what's actually happening in the brain. Essential science.
Definitely. These are people who've really shaped the field.
And the list goes on. Monica Williams.
Her work focuses on cultural sensitivity in psychedelic therapy and research. Hugely important area.
Absolutely. Amy Emerson.
Formerly CEO of Lykos Therapeutics, the company that was MAPS PBC, running the MDMA therapy trials, so right at the sharp end of development and potential approval.
Key role. Amber Capone.
From VTS, Veterans Exploring Treatment Solutions, bringing that direct experience of how these therapies are impacting the veteran community.
Powerful advocacy. And Marcela Otálora.
Also central to the MDMA therapy research. A principal investigator on those crucial Lykos trials. Deep clinical experience.
It really is an incredible lineup. Voices from so many different vital parts of this whole picture.
Yeah, research, clinical work, advocacy, policy, business, cultural context. It seems very well-rounded.
So for people listening who might be thinking, wow, I want to be part of this or contribute somehow, are there ways to get involved?
It looks like it, yeah. They have calls out for presenters if people have research or insights to share.
Okay.
Also looking for community partners, creatives maybe for that deep space area, and volunteers.
Volunteers are always needed for big events.
For sure. And importantly, they also mentioned scholarships, trying to make it accessible.
That's great to hear. Accessibility is key.
Definitely. So
Yeah.
multiple avenues if people want to participate more actively.
And if people just want to keep track of developments, as speakers get confirmed, registration opens.
The best way is probably to join their mailing list, the Psychedelic Science mailing list on their website.
Standard procedure, but effective. Get updates straight to your inbox.
Exactly. They'll likely send out announcements about registration, program details, speakers as they're finalized.
Good tip. And what about organizations, companies in this space? Opportunities for them?
Yes, they mentioned sponsor and exhibitor opportunities.
Makes sense for a conference this size. A chance to connect with that big audience.
Right. For anyone working in psychedelics research, therapy, tech, education, whatever, it's a major platform to network, showcase what they do, make connections.
Be part of that conversation shaping the field.
Precisely.
And if we haven't covered a specific question someone has,
The conference website apparently has a pretty detailed FAQ section.
always check the FAQ first.
Always. And if the answer isn't there, they provide a way to contact the organizers directly.
Good. So resources are available for more info. Okay, so wrapping this up, thinking about this deep dive into Psychedelic Science 2025, it really feels like more than just another conference.
I agree. It feels like a marker, a significant moment for this whole field.
Bringing together all these different threads, science, therapy, policy, culture, community, all focused on this idea of integration.
Yeah, the scale, the breadth of topics, the theme itself, it all points to this growing recognition of, well, the potential here, potential to tackle major mental health issues, potential to understand the mind better.
Potential to foster healing in different ways for different communities.
Absolutely. It highlights the momentum, doesn't it?
It really does. So for anyone listening who's tracking developments in mental health or medicine or even just fascinated by consciousness, this seems like a key event to watch.
An unparalleled opportunity, probably, to learn, to connect, to see the cutting edge of where things are heading.
A real snapshot of a field in rapid transformation.
Bringing together the researchers, the clinicians, the policymakers, the advocates, everyone who's shaping it.
So maybe a final thought to leave our listeners with. As psychedelics move more into the mainstream, as the science accelerates, how might this actually change things?
Yeah, like fundamentally change our understanding of the mind, of well-being.
Even what it means to be conscious. What big questions does this conference and this whole movement raise for you personally when you think about the next 5-10 years?
It's a profound question. How will society integrate these powerful tools and the knowledge they might unlock? This conference feels like a really important step in that ongoing exploration.
Definitely food for thought. Thanks for unpacking all that.
My pleasure. It's a fascinating space to watch.